If you're a man dealing with a hydrocele, you know that growing swelling can make you feel like you're stuck with only one real option: major surgery. But what if there was a modern, much less invasive solution? Well, in this explainer, we're going to dive into exactly that.
First things first, let's get to the heart of this. We need to talk about what this condition actually feels like, because it's so much more than just a medical definition. It's a daily reality for a lot of guys.
So, I've got to ask, does this sound familiar to you? That constant awareness, that feeling of fullness or heaviness that just won't go away. If it does, then you know exactly how much this can mess with your comfort and even your confidence.
When you look at the symptoms, it usually starts out as just a painless swelling, but then it turns into this feeling of heaviness. And as it gets bigger, even simple things like walking or sitting down can become genuinely uncomfortable. And, we have to talk about the emotional side too, the self-consciousness that can creep in. If this is what you're going through, you are definitely not alone.
So, what's actually happening down there? It's pretty simple, really. A hydrocele is just a collection of fluid that builds up around the testicle. Now, it's really important to know that it's typically not dangerous, but hey, not dangerous doesn't mean it isn't a problem, right? Especially when it gets large, heavy, and just plain uncomfortable.
So the natural next question is, what can you do about it? Well, for a long time, the options have been pretty limited. It's often left men feeling stuck between a rock and a hard place.
And here is that classic dilemma. On one side, you've got something called aspiration. It's a simple office procedure where a doctor just drains the fluid. It gives you some relief, sure, but the problem is the fluid almost always comes back. On the other side, you've got full-blown surgery. And yeah, it's effective, but it's also a big deal. We're talking anesthesia, a surgical incision, and a much, much longer recovery time.
And this is exactly why so many men have been hoping for a door number 3. I mean, who wants to choose between a fix that doesn't last and a major operation? It's not a great choice to have to make.
And this is where the story takes a really interesting turn. This is where we introduce that door number 3. It's a procedure called hydrocele sclerotherapy, and it offers a totally modern, completely different approach.
Sclerotherapy isn't just another option. It's really that ideal middle path everyone's been looking for. It's designed to be a lasting solution, way more effective than just draining it, but without the incision and the long recovery of major surgery.
Okay, so how does it actually work? Well, the solution is surprisingly straightforward and, honestly, pretty elegant. We're not talking about any major cutting or removal of tissue here at all.
It's really just a simple 3-step process. First, using an ultrasound to see exactly where to go, a small needle is placed into the fluid sac. Second, all of that fluid is drained, which gives you immediate relief. And third, and this is the crucial step, a special sealing medication is injected. This stuff is called a sclerosing agent, and it basically causes the lining of that sac to stick to itself and close down, which stops it from making more fluid.
Let's just pause on this for a second, because this is the single most important point. The entire procedure is done through a needle. There is no surgical incision. No cutting. Just a tiny little entry point that gets a small bandage when it's all done.
The whole idea is beautifully simple. Once the fluid is out, you've got to make sure it can't come back in, right? Well, this medication essentially seals the container from the inside so it just can't refill. It's a remarkably effective concept.
So who is this actually for? See if this sounds like you. It's an ideal option for men who are really bothered by their symptoms and want to avoid surgery. It's especially great if you've already tried aspiration and that fluid just came right back. And of course, it's for anyone who wants a significantly faster recovery.
All right, so the procedure itself sounds great, but what about life after? This is where the difference between the old way and this new way is it's like night and day.
Just look at this comparison. Surgery usually means a hospital stay, with a recovery that takes weeks. Sclerotherapy, on the other hand, is an outpatient procedure. You go home the same day. And the recovery? We're talking 1 or 2 days. No incision means you get back to your normal routine so much quicker. The difference is just massive.
So let's just recap what that recovery looks like. You go home the very same day, you're typically back to normal, non-strenuous activities in a day or two, and since there's no surgical wound, you don't have to worry about caring for one. You might have some mild soreness, but that's usually managed with just an ice pack.
So, I'll leave you with this final thought. Just imagine for a second what it would feel like to move, to sit, to walk without that constant feeling of heaviness. Could a simple, minimally invasive procedure that avoids an incision altogether give you back that daily comfort and confidence? For so many men, the answer is a resounding yes.